So if you're coming in with a knee problem, you've had chronic knee problems, and you go to a regular doctor and they're telling you you need surgery or you need steroid injections, that's not going to solve your problem. Surgeries can possibly help, but there's a lot of side effects, right, that can come from surgeries. And I mean, you can even die from having surgery, right? So what we do is non-invasive injection therapy, and it's called regenerative medicine. And it's with either Prolo, dextrose, PRP, ozone, stem cells, or exosomes. So there's many different mediums that we use to actually inject and help the body heal itself. PRP is your own blood product. What we do is we take it, we spin it down, we get the platelets, which have growth factors in it, and then we inject it into different areas where you're having pathology, where you're having pain. So 3 to 6 sessions of doing this and you'll be pain-free. I've had many patients come in with chronic knee pain or chronic back pain, elbow pain, shoulder pain, and they're able to get out of their pain from just a couple sessions. No surgery, no medications. It's really a miracle. And it's your own body doing all the work, healing. Yeah, so what ozone does is, it's a gas, it's 3 oxygen molecules that are put together, and it highly reacts when it's put into a joint, put into any part of your body. So when it's put into your joint, what happens is it dissociates into 2 oxygen molecules, and it actually tells the body to come heal that area. And ozone super oxygenates that area so that there's more blood flow to it, so it can be healed. Your tendons and ligaments don't have a lot of blood flow, that's why they're hard to heal. So when you do ozone combined with PRP or stem cells, then it's going to actually improve the process of healing. Yeah, so we're finding out about stem cells now that it's actually possibly not the stem cells that are doing the work, but it's what the stem cells are putting out, which is called exosomes. So what happens here is your body has a reaction once the injection is put in, once the stem cells are put in, and your body will come heal because of the stem cells telling the body to come heal. So it actually activates your own stem cells in the process.
Fantastic.
Yeah.
So do you do exosomes? Tell me more about the exosomes. How does that process work?
Yeah, so exosomes, it's all the same procedure, whether we're using PRP, dextrose, ozone, exosomes, stem cells, it's all the same process. The difference is that exosomes and stem cells are similar, but exosomes are the byproducts of what stem cells are creating. So stem cells are, I have a good analogy to it. Stem cells are like the general, and exosomes are the fighters. I don't know if that's a good analogy.
Yeah. Like the troops.
Like the troops, yeah.
So the difference that I see is conventional medicine, that I go to the doctor or I go to an orthopedic and they're saying, hey, here's some drugs to cover it up, or here's some surgery, and maybe we'll cut something and put it back together and it'll work. What you're saying is your stuff is more, it's regenerating. It's helping my own body saying, hey, we know that you have pain, there's a reason why you have pain, and you're injecting the right signals into my body to allow them to heal themselves. So you're regenerating tissue, regenerating tendons, regenerating cartilage, as opposed to just covering it up with steroid injections or medication.
Correct. Right? Yeah, it's more regenerative. It's exactly what you just said. Instead of just covering up the pain like steroid shots do, steroid shots are actually horrible for your joints. You know, they actually deteriorate the small tissue, the soft tissue that's in your joints. So doing 3 of those is not good. Doing more than 3 of those, I mean, you might not be able to heal your joint. So using these other regenerative injection therapies can be really beneficial and can get you out of pain. Yeah, so the process usually takes about an hour and a half for the whole procedure. You'll come in, we'll take your blood, do an exam, and then after that, it's just the injection. So it doesn't take that long. You're able to walk out. You're able to, probably work out in a day or 2. So most patients have a little bit of pain for 2 days, but as soon as you can get moving on it, we want blood flow to get to that area, whether it's your back or shoulder. We don't want you to work out hardcore, but we want you to start working out or doing normal activities so that it can start healing.
And how long is how many times do I have to come back in for these types of procedures typically?
Yeah, so usually it's 3 to 6 if it's dextrose prolo or PRP prolo. If it's stem cell, then it's usually one injection, yeah. Stem cell or exosomes, yeah.
Awesome.
So what separates me is I'm a naturopathic doctor, so I treat the whole body. So not only am I going to do the injections for you, but I want to get you on the right plan, whether we're doing IVs, I want to look at your diet, I want to look at your inflammatory markers. So, I work with the whole body. We'll get you on some supplements. We'll really fix what's going on internally as well as, your joint.
Yeah, because I think that makes a difference. I think a lot of times people get stuck in hey, my knee hurts, and they don't think, well, that may be because you're eating an inflammatory diet, or maybe your hormones are off a little bit, and you're creating this inflammation. There's a lot of reasons why people have pain, right?
Yeah, exactly. It can be a food sensitivity. So, really diving deep and looking at that as well. You need to call or you need to fill out a form, and I want to see you. So, you need to come in for a consultation. This consultation, what we're going to do is I'll do a physical exam. I'm going to look over your whole history, and then I'll recommend what's best for you and your situation. Maybe it's stem cells, maybe it's exosomes, but maybe it's not. Maybe it's a less expensive treatment with dextrose or PRP and ozone, because you don't always need to do a $20,000 or $15,000 procedure. It might be not that bad. So I want to look at imaging for you as well. So.